It's AFA Today from the studios of AFA Today in New York City. Kevin McCullough, glad that you're with us. Last night, it was the Fox News Channel taking their time to tell this story. Megyn Kelly reported on it this way.
Breaking tonight, Fox News has just confirmed that while the president was promising you could keep your health care plan, the White House has known for almost 3 years, if not more, that that promise would not hold for millions of Americans. And we have evidence. Good evening, everyone. I'm Megyn Kelly. Americans heard this president say it over and over. If you like your doctor, if you like your plan, you can keep them under Obamacare. But many had doubts. One major concern, that those buying insurance on the individual market, people who don't have employer coverage, would see their plans canceled. Why? Because those plans tend to be cheap with less benefits. And Obamacare requires insurers to beef up their coverage. That costs money. The fear was that insurers that are forced to offer more benefits would also raise rates or maybe dump the policies altogether. And that's exactly what is happening. Contrary to the president's explicit promises. Listen.
Actually, any insurance that you currently have would be grandfathered in so you could keep. And so you could decide not to get in the exchange the better plan. I could keep my Acme insurance. Just a high deductible catastrophic plan. I would not be required to get the better one.
But as we were already saying, that's exactly the opposite of what happened. Kevin McCullough, live back with you at the AFA Today microphone. Thank you for being here. Now, it's very simple. If you've got a grandfathered policy, you were there were some things, there were some limitations put around that policy, and one was that nothing could have changed about that policy since the time that you had first bought it, and that if it changed in the least and then didn't meet the what they call the minimum requirements, that there would be in some way a very high chance that that policy then would not be grandfathered in. And so they made this very narrow possibility of you being able to actually keep the policies that you had. Megyn went on to explain that, of course, that wasn't exactly how it turned out.
But that's not what's happening at all. Exactly what he said would not happen is happening. You are required to get rid of your Acme plan, and you are required to buy one on the exchange, and it is costing Americans more. So far, nearly 1 million policies have been canceled. Over 10 million more could end very soon. We're talking maybe 14 million. And with the American people now demanding answers, you can keep your plan, period, today turned into maybe, for most, for the majority. Well, some can, et cetera, et cetera, et cetera. Here is former White House senior advisor David Axelrod earlier, and then some follow-up from our own Ed Henry.
Most people are going to keep their own plan, Senator, and you know that. The majority of people in this country, the vast majority of people in this country are keeping their plan.
This morning, David Axelrod was pressed on that point and said the majority, the vast majority, will get to keep their plans. He no longer works at the White House. From that podium, will you admit that when the president said, if you have a plan, you'll get to keep it, that was not true?
Well, let's be clear. What the president said and what everybody said all along is that there are going to be changes brought about by the Affordable Care Act that create minimum standards of.
All right, see, that's and that's what that's what it's all coming down to, the minimum standards. So what does that mean? What does the minimum standard mean for the talking heads about the Obamacare situation? Why are these policies being canceled? Well, for instance, they want every policy to offer the exact same thing to every single person. Well, here's how ridiculous it is. I don't happen to be a woman. I know this is shocking to those of you that are listening and hear the tone of my voice and the depth and the vibration of what my baritone produces, but I am not. Therefore, it makes very little sense in any way whatsoever for me to have a policy that would give me birth control. It makes very little sense to give me a policy that would allow me to get an abortion. I can't get an abortion. I don't have the ability to produce a child in my body. But by me having to have a policy that pays for this, they have made this argument that this is in some way fair, that this is the equitable thing, that everybody should be required to have the same. Well, I don't need a policy that has those things. So why don't we take the risk out of the policy that I get for me and say, let's just get a policy that's really good for a middle-aged man who's the father of 2 ankle biters and a lovely bride and is living his life in a quasi-healthy manner. Why don't we do that for the 43-year-old male? No, we can't have that. We've got to have the same for everything, all the time, everywhere. Well, now you know why that story occurred yesterday, where you had a 56-year-old woman in Florida who had been paying $54 a month, suddenly now paying $591 a month for her new health care plan. You know what? The 56-year-old woman doesn't need an abortion or birth control either. But this is the crux of the issue. And the insurance companies can't provide policies that cover that much stuff for everybody and even come close to keeping their prices low. And by the way, the exchanges in Obamacare, they can't either. That's why most people that are getting on the Obamacare exchange policies are seeing their bills skyrocket, even though they were told, first of all, you could keep the policy if you liked it, which that's not true, and that the costs were going to be less. I want to know if you've gotten an insurance cancellation letter from a policy. 888-589-8840, 888-589-8840. Let's talk to Mark in Texas. Mark, welcome. You're on with Kevin McCullough on AFA Today. Glad you're here.
Hi, Kevin. I like your tunnels analogy that you gave earlier, but I wanted to share with you a couple of insights that perhaps the public is not getting and the media kind of glosses over.
Sure.
As it relates to grandfather plans and also non-grandfather plans, I have found that the small group and individual health insurance businesses, frankly, have been decimated. There are no longer any commissions allowed to be paid. The companies just basically can't afford it because of the 80-20 rule that eliminated the brokers out of the business. So I'm working on contract right now for one of the colored companies that we would all recognize. It has 1.8 million members calling us to complain about either their rates going up with the grandfather plans or the non-grandfather plans. And basically what the companies are doing is we're trying to retain the business on the books. For those that have grandfather plans, people are saying, well, I thought the president said that we get the keeper plans. I said, well, that's true if it's if it's still available. And the other part of that equation is, are the doctors going to be in the networks? Because they're not under a mandate for participation. So what's happening
exactly.
So even if you have a grandfather plan, if I could give you a quick example, down in San Diego, California, there's 14 companies that are participating in Covered California Exchange. However, there's only 3 plans that are offering anything in San Diego County. And people with your analogy, a family member buying his own and maybe a small employer, they're seeing their premiums triple. And what they're getting includes the essential health benefits for, maternity and mandatory pediatric dental and so forth. So they're wondering why the grandfather plans are doubling or tripling in cost. They can keep the plan, sure, but if they do, they're going to be paying outrageous rates. And I can go on those analogies, but the other thing is they're losing their PPO coverage and going to HMO coverage if they stay there. And that has limited choice for doctors. And by the way, a lot of these doctors go through what's called a deeming in process, where basically the insurance companies say, oh, by the way, you're now on this network. So as these doctors begin to recognize that their pre-existing patients from their PPO contracts are coming to see them and they're getting HMO reimbursement instead of PPO reimbursement, there's going to be even more underlying issues there. Now, as for the non-grandfathered folks, they're being offered a one-time exception that's been negotiated with individual states. I'm licensed in 22 states, and I've seen this in a number of states like here in Texas and Georgia and a few other states where they're being offered a one-time exception to renew for a full year, but it's going to include rates that include the ability to maintain that policy with all the essential health benefits, including guaranteed issue, no more annual limits, no more maximum limits. Essentially, now anybody can purchase health insurance from their hospital bed, and without any consideration for ratings based upon underwriting. So there are a number of issues associated with that, and what I'm saying is the imminent collapse of the whole system. And I kind of think this was designed because when insurance companies say, "Hey, we can't sustain this anymore," what you ultimately end up with is a massive government system, single payer, which we all know Harry Reid confessed that, and it's really a tax plan because the ramifications for people who are opting out of the exchanges, they're not eligible. That's another thing. People think you're eligible for these subsidies, but what the president has failed to discern is the fact that if people are purchasing health policies with a tax subsidy, which taxpayers are paying for in the trillions, by the way, what you're going to see is the imminent collapse of the whole system as people begin to recognize, hey, this is nothing but a disguised tax system and single-payer payment system. So there's a lot more to this when you drill down in it. And I see dozens and dozens of these letters, and if it's probably just as well not to send you the content of that, but there is for both grandfathered and non-grandfathered, and this is just the tip of the iceberg. What the press is beginning to pick up on now, I just see the imminent collapse of the entire insurance system because the brokers are out of the equation now. Yeah,
the brokers are gone. Doctors are on their way out. Far fewer services going to be provided by far fewer doctors, and the subsidies are going to run out because the subsidies are only going to be paid for by taxpayers that are able to afford to pay the taxes that make those subsidies up. And here's the problem, Mark. We're broke. The average family's broke. There's so much debt on the average family. The idea of sending your monthly cost for your health insurance to a tenfold exponential, as that woman in Florida found out yesterday, friends, multiply that times every person listening to this show today. Can you afford that? Can you afford to pay $12,000 a month in health care premium? Not that it would for every person, but if you're paying $1,000 now, can you afford to pay $12,000 a month? Nobody can do that. It's unsustainable. And what we're talking about is, yes, probably a setup to a complete implosion of the entire healthcare system. Some of us tried to tell you about this going into it, and some were so selfish in saying no. It's my right to make you pay for my health insurance. It's my right. I have the right to make you pay for my health insurance. But the way they said it was, well, we're going to get free health insurance because Obama's going to give it to us. That's where all of this went bad. The idea that you got something for nothing if you just elected the right guy was foolishness. It was demonic. It was satanic. It was evil. It didn't represent scriptural principles to try to take something from your fellow taxpayers for nothing. That's theft. If you think that the government should be paying all of your Medicare and all of your health care issues all the time, if you believe that you're owed that from the government, you're stealing. Not from the government, because the government doesn't exist. It's just a bunch of people that we hire to go to Washington to organize and to try to figure out a way to help administrate the country. If you think that your neighbor has the obligation to pay for you, you are stealing from your neighbor. And this is where we lost it. We thought we're going to get something for free. Yeah. You tell them, Obama, it's about time we get something back for free. Yeah. Nothing's for free. And now what we've shuffled is just an enormous mess. 888-589-8840. Let's go to Charity, who's also calling us from Texas. Charity, welcome. You're on with Kevin McCullough on AFA Today. Hi.
Hi, how are you?
I'm okay. Thanks for calling.
Me and my husband are self-employed. Self-employed people have to cover their whole insurance premium. We don't have a company to help us. But we've had a health insurance because we decided we wanted it and we budgeted for it. And we were paying like $438 a month when we started. Now we don't even qualify for it because of Obamacare. We're out of insurance right now for the first time in 7 years until January the 1st when we can enroll for some insurance company will take us, but right now we're uninsurable, they said. So come January the 1st, we're going to have to pay $1,167 a month.
You had a policy in the 400s.
Right. And
to
then
get the
those
same
people-
policy, or maybe not even as good a policy, in January, it's going to cost you more than twice that.
It's going to cost us more than twice. We're self-employed. We had it because we wanted it. And American people, if they want something bad enough, they can budget for
Right.
it. If
And
they
here's
don't
the
want
thing,
it,
Charity.
they're
Here's the
forced to
thing.
buy it.
Here's the thing. You're an honorable person. You're a good person, because there are other people living in towns all around us that have not had health insurance, that when they just got sick, they just went to the emergency room and they just dumped all of that cost onto the local community, paying for the taxes for that hospital. You guys were actually honorable people. For 7 years, you've been running your business. You had your policy in place, and you made sure that you weren't a burden to the people around you. Now you're being punished, and it's going to cost you twice as much to just continue to do what you were doing already before. Unbelievable. Charity, I'm so sorry for your situation, but I'm glad you told us the truth. $400 a month, $1,100 a month. Did you get a cancellation letter from the insurance you're buying? What did it say? How did you respond? What will you do? 888-589-8840. President Obama knew 3 years ago that millions of people were going to lose their health insurance if Obamacare passed, but he kept telling us we could keep it anyway. 888-589-8840. Coming right back.